Okay, so something I'm pretty excited about. A lot of you know I do a lot of secondary breast surgery, implants that have been in a long time, or patients who have problems with their implants. And one thing that we're working on here, that I'm working on, is a more precise way of fixing some of these problems. And we're going to start coming out with some pictures online, show you what I'm talking about. So it's sort of a stay tuned kind of message here, but the bottom line is when you have a patient whose implants are way too low, it can be a very, very difficult problem to fix. And we've come up with a technique. We're going to maybe call it the exact lift or the exact implant lift. And I think everybody's going to be really interested to see some of the pictures coming. So yesterday I started talking about this exact implant lift that I'm developing with the exact suturing device that we'll talk about in a little bit, but wanted to show everybody a case that we did recently. And in the next picture you're going to see the preoperative picture of a patient who's had implants for 20 years. They're saline implants, and you'll see from the picture that they're very low and lateral. They've kind of fallen out of their pocket. So this next picture is actually halfway through the operation. You see we fixed one implant position, and she actually got new implants during this operation, but you'll be able to see where the implant needs to be on the right side, and that's fixed, compared to where she came in on the left side, which is unfixed. So this next picture is a picture of the exact suturing device being used, and basically it helps me place a very, very precise stitch that allows me to hold that implant in position. It's a technique that we've done for many, many years, but using the exact device really brings a whole new level of precision to it. So the exact suture device was actually developed by a good friend of mine out in New Jersey, Dr. Christopher Godek, and it was developed primarily for facial stuff, but he does some tremendous work with facelifts, mid-facelifts, and you should check it out. But as far as I know, this is the first time we've used the device on a breast surgery, and I do a lot of breast surgery, so we wanted to find a way to really make that implant repositioning operation as predictable and precise as we can possibly make it. So the last picture is actually at the end of the operation. You can see both sides have been fixed, nice and even. The implant is well positioned on both sides. Of course, she has brand new implants on both sides, and we'll be looking forward to seeing some post-op pictures in the next couple of weeks of the same patient. So we did get a private message asking about doing the exact breast implant lift in patients who've had mastectomy and implant reconstruction. Whether or not this would be a good thing to try to fix an implant that maybe isn't where it needs to be. And the answer is absolutely yes, that it would be very good for this. Reconstruction after mastectomy can be very challenging. I personally don't do insurance reconstructions anymore, but I certainly see patients who are many years out from their implant reconstructions from mastectomy and breast cancer who need some aesthetic improvements. And for those types of patients, the exact device, the exact implant lift would be, I think, very, very helpful. So a really good question. No, the implant lift that I'm talking about just fixes the position of the implant. And a lot of patients are still going to need some kind of a lift for their breast tissue.